This is It's Not In Your Head podcast with Dan and Juz. Dan is a doctor and Justine a pain coach. We've come together to find ways to manage complex chronic pain better for both patients and providers. Hello and welcome to another episode of It's Not In Your Head podcast. I'm Justine Feitelson, here with my co-host, Dr. Dan Bates. Hello, Dan.
Morning, Juz. How are you?
Swell.
Here we are. It's one of Australia's greatest holidays today.
I thought you were going to say it's another beautiful day on the It's Not In Your Head
It's one of Australia's
podcast.
greatest. This is a holiday in Victoria that we have the day before grand final day. It's kind of like whatever. Like as I remember this holiday only came in about, I don't know, 4 or 5 years ago, and it came in
as all good holidays do.
As all good holidays do, as a election promise. And so I reckon if you really want to get elected in Australia, just give us another holiday.
Promise holidays.
We love it. We love a public holiday in Victoria. My staff were telling me we have like nearly 2 weeks of public holidays throughout the year. It's great. Yeah. Unless you're like the employer like me and you're the one paying for them. But anyway, it's good for,
aside from that,
it's good for everyone else. And then here I am working anyway.
I know Dan was a little late today and I was a little nervous about our recording window, but it's a holiday. So there's no
It's
cap.
a holiday.
When you were saying it's the most important holiday in Australia, it made me think of how in Hungary, Hungarian Independence Day, it's like the most important holiday to show your national pride.
Yeah, no. I think every holiday in Australia is Australia's most important holidays. We just don't want to go to work.
Well, we got to go to work, unfortunately. So
all right, here we go.
Here we go. Today, we are going to get into another one of the buckets of sensitization. So if you are someone who either post-pain or even before pain has struggled with some of the things related to mood around depression, anxiety, and also from a managing stress perspective, which we'll kind of get into as well. This episode will get into a lot of the conservative strategies that you yourself as a patient can use to kind of downregulate and improve not only your breathing mechanics and some of those things that affect the nervous system and how heightened you can get, but also using mindfulness and some other techniques around filtering and how to sort of shift your perspective on managing and living with pain. So this is kind of a coping episode more than a curing, or find and fix. So there's like, look for the pain drivers, and then there's manage the pain you have. And this will dive deep into that bucket of things as a patient.
Yeah, and manage the consequences. And I think that one of the things I'd say from the start, that if you've got chronic pain and chronic pain has taken away the things that you want to be able to do, and it's taken away your work, and it's changed your relationships, and it doesn't make you sad, you're not normal. And if chronic pain, when you move things hurt, if that doesn't make you anxious, you're not normal. And so it is 100% normal to feel sad and depressed and anxious and fearful to move if you have pain. Now, the thing is you just need to be able to control those things. As they, escalate, just like anything, they make things worse. And so this is what Jaz is going to talk through, is a range of strategies to then be able to manage that response. But let's be honest, it's normal. And those people who are super copers, I saw one this week actually. Absolutely star. Amazing. Yeah, gold star. That aren't depressed and aren't anxious. They are the rare people within, the chronic pain population. Yeah. So give yourself a break. It's okay. But let's try and do something about it.
Exactly. Yeah. Just limit the impact that it has on you. It's like it's with stress too. You can't make stress go away. It's an inherent part of life, as are these other things that fluctuate in our world, and being able to just limit how much it then escalates pain, or the other amplifiers that make pain worse, allows you to not go up on the pain scale as easily and feel like you're in more control as well. Because when you feel kind of helpless and like you can't impact some of these things, that also can make pain worse. And if you're someone who really does struggle outside of more typical anxiety, depression, if you have PTSD, trauma, a lot of difficulty from a coping perspective with regards to illness behavior, or some of the things that we've talked about around catastrophizing, that's the cue to sort of refer in addition. So what we talk about in this episode cannot manage all of that or some of those deeper, more significant things. So those are what you want to refer and also get psychological help for and other things. But this will help shift some agency back to you as a patient so that as well, you are not just outsourcing constantly and have no way to impact. So that's our goal for today.
Okay.
All right. So let's start out with a little bit of a conversation around stress. And for the purposes of this chat, let's kind of put stress into a context of something that we're going to be talking about a lot more down the line with regards to what we call allostatic load. And Dan, would you like to take the baton on this one?
So allostatic load is the cumulative response or cumulative physiological response to stress. Now, stress can be just the stress of activity, the stress of day-to-day life. But basically what takes place is whenever you load your body with any sort of stress, physical, mental, emotional, you have a response to that. And so you can think about it in three ways. Firstly, you have primary compensation mechanisms. So your primary compensation mechanisms within this are your nervous system responses, so increases and decreases in sympathetic and parasympathetic activity, and hormone responses, so increases and decreases in cortisone levels and adrenaline levels, in, et cetera, et cetera. So they're primary compensation mechanisms. Now, what takes place then is you've then got a set of secondary compensation mechanisms. So secondary compensation mechanisms are probably a little bit easier to test. So they include things like changes in your blood, such as increases in your glucose or your long-term glucose measures, which is called your HbA1c, which is the amount of sugar that's on the outside of your red blood cells. And then other things like your body mass index or your weight, your waist to height ratio, your blood pressure, your et cetera, et cetera. So basically what you're measuring there is you've got first line compensatory mechanisms, which are nervous system and hormone changes. And then when they get overwhelmed, you've then got secondary changes that we measure as blood pressure changes, blood work changes, et cetera, et cetera. When they get overwhelmed, that's when you go on to develop disease processes. And so the easiest way to think about this is, if you're thinking about in the concept of diabetes, so your first line compensatory mechanisms are you eat like way too many carbohydrates. And then what takes place is your insulin starts to go up because your insulin is controlling your blood glucose levels. So that's your primary compensation mechanism. Your secondary compensation mechanism then is changes in your HbA1c, so the glucose on the outside of red blood cells. And then once you get over a certain level of HbA1c, so 6.5%, now you've tipped into diabetes. So now you've got the disease component.
Actually a disease.
And so that is this progression of physiological stress. In that example, the physiological stress is carbohydrate load, which then pushes each one of these things up. And so you can apply that across multiple systems. If you want to nerd out and go have a look at this sort of stuff, the allostatic load data is fascinating. And basically higher levels of allostatic load, even as a child, increase your risk of long-term increases in cardiometabolic disease. So this stuff's been around, I think, since the early 90s, but it's really just starting to get more legs at the moment in the literature. And I think we're going to very much see that this is going to be how we can identify what metabolically is going on underneath.
And adding to pain.
And certainly there's already data that shows that patients with high levels of allostatic load, and high levels of allostatic load aren't that high. Like it's not like we're talking,
like it's not that hard to start tipping.
It's not like you're talking
threshold.
about you're in bed and you're completely
bedridden.
Bedridden. No, this is like you've got high blood pressure, insulin resistance, high cholesterol, and you've got a big belly. Like that, there's your four, then you're significantly more likely to be having chronic pain. So
that doesn't get into even all the non-metabolic stressors,
we haven't even
things that add to that. So it's a big deal.
We will be covering that as we go forward into the future as part of our, if it's not in your head, where's it coming from? Part of it's metabolic, and you measure it as allostatic load. So anyway, what we're going to do though now is probably more importantly, and I think this is a super episode for people because this is just some very simple techniques that
Yeah.
you can take and you can apply to yourself, and you can go, hey, my friends, my family, hey, listen to this. Here's some things that you can do to like control your own stress.
Right.
Because if you're not stressed in
Uncontrolled.
this environment, then you're not normal. And these give you some simple techniques to take back control. And you know what? If you're going to get control of this, you have to own it. And this is one way to go about owning this side of things. So,
Yeah.
Jazz,
All right.
breathing,
Yeah, breathing.
the
And when you're
ultimate biohack.
oh, ultimate. Yeah. And I say that
Go.
because, oh God, in our culture today, it's like biohack this, biohack that. But why I do call breathing like a legitimate biohack is because what's really cool about it is you immediately feel the impact of that from a nervous system perspective. So there's not a ton of things that you can just do, and it pretty immediately can have a bit of an impact. And when Dan was talking about some of those early signs of stress getting higher, right, heart rate and different things, and when you have nervous system dysfunction, again, you have a smaller margin for error. And so if you can learn to be more mindful and aware of, oh wow, I am breathing really shallow, oh wow, my heart is really racing, oh wow, I am pretty anxious, because some of us struggle to recognize that just because we're not paying attention as much, or because of a lack of interoception with the neurodivergence piece. It can also be hard to sort of check in with yourself and sense some of those things. So this is about building awareness of your own body and then being able to change some of those default patterns that we all, get stuck in. You're around someone you don't like, doesn't feel good, higher heart rate, right? Stressful situation, whatever it may be, and being able to impact that quickly in a way that's at your fingertips is important. So breathing, get into it. Breathing is a funny topic because it's like everybody breathes. So you're not doing it wrong. Obviously, you haven't exploded into a million pieces, but breathing can have a huge impact on not just our nervous system, but a lot of different parts of our own bodies, from our GI tract to our pelvic floor to our core stability. It affects things from a diaphragm vagus nerve perspective. And a lot of us are prone to mouth breathing. So if you are someone who breathes in and out of your mouth, one of the easiest, most helpful changes you can make to begin with is to breathe ideally in and out of your nose, at least in your nose and out your mouth. That can be a good little first shift, because there's a reason that we have a nose. These little hairs in there, those guys, they warm, filter, humidify the air, and our mouth does not do the same thing. So when you're in your chest, kind of shallow breathing, I kind of call it breathing like a dragon. Breathing in your nose, you have small little nostrils. So that also forces more diaphragm involvement than when you're breathing out of your mouth. So practical signs of breathing dysfunction, other than being aware of being a mouth breather, are things like if you're...
Sorry, every time you say being a mouth breather, I'm not so sure, like, in the US, is calling somebody a mouth breather an insult? Because
No.
in Australia it is.
No.
Like,
what is it? What type of insult is it? Like you're annoying?
I don't know what category you'd put it in, but it's not positive. Okay.
See?
Mouth breather. Like,
That's why I want to
honestly,
change that. Oh my God.
that's hilarious. Anyway,
That is super funny.
So Jazz isn't trying to be offensive to all the mouth breathers
All the
out
Australians out there. Yeah. No. That's super funny. So some practical signs of, are you maybe breathing in a less than ideal pattern are things like, are your ribs kind of poking out when you're standing? Are your neck muscles kind of hypertrophied in the front and sort of pop out when you talk? I was prone to this earlier in my career when my breathing would get a little bit disordered and I'd be giving presentations. I could see it in my neck that I wasn't having good diaphragm function. I'll stand up for a sec. If you have a hyperlordotic back where it's kind of like you're going to the club, like you're leaned back pretty far, that also makes it like an open scissor position, which doesn't allow you to sort of have your shoulders stacked over your hips and kind of create a more pressurized, like a soda can, so to speak.
I'm so disappointed you don't have the I love
I
New
know.
York,
I knew you
like,
would be. I
pants
thought
on
about
today.
putting them on. Once was enough. Famous for the wrong reasons. And then, do you just have poor breath stamina? Like, do you, as soon as you exhale, feel like you almost have to inhale, or else you feel uneasy and you're out of breath? So not with movement, but just throughout daily life. What's interesting and I think helpful to also get buy-in from folks from a breathing perspective is to understand how much it affects the different systems of our body. So from a GI perspective, if you're someone who struggles with GI stuff, GI distress can lead to more chest breathing because it hurts to breathe. So you breathe less and more shallow, but then that too can kind of rev things up and you miss out on this sort of like visceral massage for your guts and kind of a natural mobilization technique from a GI perspective when your diaphragm is actually functioning like it should be. From a pelvic perspective, it doesn't allow proper weight to be on the diaphragm. And so dysfunctional bracing strategies can also keep breath kind of higher in your chest and an inability to expand 360 degrees around your back, which can lead to like weak deep core, tight pelvic floor, and lengthened weak low back, or just more tone and spasming then in that area as you compensate. So if you can sort your breath, it can help sort some of the length tension relationships that cause dysfunction in other areas. From a core perspective, I just touched on that sort of chest breathing open scissor position versus being able to be more centered and not use chest accessory muscles to breathe. This is a big piece of sort of underlying subconscious stability, not in movement even, but just as we move about our daily life so that we can breathe and brace without having to focus on it. From a nervous system perspective, this one is, I think, more obvious to people perhaps, is the diaphragm, when you breathe, the vagus nerve runs right through it. And so that's also that sort of connection that you can help foster, where then your vagus nerve communicating from that parasympathetic perspective also elicits more rest and digest. You get a little bit out of that default fight or flight state, like instead of, which is communicating constant stress, like I'm running from a tiger, to your nervous system versus things are calm, things are okay, I'm safe, which just helps move the needle slightly in the right direction rather than the wrong direction with pain.
I think the thing I like about, and I hadn't thought about this before, but from the perspective of looking at from an allostatic load perspective, your primary compensatory mechanisms are changes in your sympathetic and parasympathetic nervous system. And so breathing, if you grab there's a bunch of breathing apps out there that you can link to your heart rate monitor, and that will then, it does an assessment of your heart rate variability. And so by looking at heart rate variability, you can then, there's now a bunch of algorithms that pretty much go, look, you have more sympathetic output, you've got low parasympathetic output, you've got et cetera, et cetera. So if you are looking to, directly affect that sympathetic and parasympathetic outflow and you want to measure it, you can measure it using heart rate apps, and you can link that to your breathing, and it then becomes a way that you can then alter that first line of compensatory mechanism.
Exactly.
So it's nice. I like being able to, test something rather than just, I hate sitting there doing these breathing exercises. Like I never got into this stuff. Like I was like, I'll manage my stress by going to the gym and
to be fair,
lifting something.
I didn't get into this stuff until I had to either.
Punching my mates. But being able to sort of measure something makes me feel like I'm actually doing something rather than sitting there, and I'm not a meditator. So
no, and it can be tricky, like from a neurodivergence perspective too, sometimes for people to sit still, and you don't want to like shove a square peg into a round hole and almost create more anxiety by trying to force yourself to do something that's really uncomfortable. So if you can find other things that make it interesting, it's just like nutrition or any of the other things we've talked about. If you can measure it, it's just a nice way to see the difference that it makes. But what's cool with breathing, especially if you have pain, is you can typically feel it. It's also not always less pain, but it's less of that anxiety, fear, things around, and that make the pain worse. And if you're somebody with CRPS, an interesting little fact that I threw in my Basecamp presentation for this is that CRPS is kind of looked at as a, neuropsychoimmunology bucket of things, Dan? Is that the right way? Right. So your neuroimmune system is how I've seen it phrased, but they work together. And so communicating and controlling your nervous system through breath then affects that immune response down the line. So it's a little bit similar to that allostatic load initial primary compensation mechanism, is do something that can affect something else that's creating the output that is overwhelming or way too much.
Okay, so I'm going to say that to me sounds crazy, except I'm going to give you what the mechanism is. So part of the mechanism of this is how your vagus nerve affects your spleen. And so within the neuromodulation data, there is research that looks at neuromodulation, so stimulation of the vagus nerve, and its effect on rheumatoid arthritis.
Yeah,
And
that's a
so
great example. Yeah.
and what it does is that you have increased vagal activity, which acts on the spleen, interestingly. And at the level of the spleen, the vagus nerve stimulates the immune system to convert from being inflammatory cells, so macrophages that are type 1, into macrophages that are type 2, which are then anti-inflammatory. And that's the mechanism by which vagal nerve stimulation downregulates rheumatoid arthritis in an immune setting. I would think that breathing probably has a mechanism that is similar, that if you're able to increase your vagal tone, and of course you can measure it using a heart rate monitor, that the neuroimmune mechanism is probably something along those lines. So where it sounds crazy and nuts, it's actually the mechanism's already been defined. So it's kind of cool.
Thank you, Dan. That was a very good ad. Yeah, it's a trickle down effect. It's not completely correlated.
So the next bit is movement. Like, you're like the movement queen. So how does movement move in? How does movement help with stress in this setting? So increased stress. What are your take on movement?
Yeah, we'll keep this piece of the discussion pretty narrow, because in the context of stress, the way that I look at movement is it's a way to get that stress in a way out of your body. And when you're living in constant survival mode, movement is also a way sort of out of that constant stimulation and overreaction to everything. And it allowed me, even in my earlier, like the very intense CRPS days, it was one of the few times I felt more present and not trying to escape my body. And I think with chronic pain, it's it's an interesting fine line of, you're trying to distract yourself and not pay attention, but you're also not trying to constantly escape your body. And also this sort of accumulated stress gets stuck in your system. You have no way to drive it off, right? Dan just talked about, how does he deal with stress? He works out, he punches things. Well, when you can't do that, your options become more limited. So that's also where then some things like breathing become more important if you're still very limited with movement, but ideally working towards things from an aerobic perspective or from a resistance training perspective that allow you to express some of that and kind of drive it off. So it's not just this pent up, uncomfortable accumulation. And the way I link breathing and movement is that I look at breathing as like the most fundamental movement pattern. So movement patterns are just push, pull, hinge, single leg, squat, core. But breathing is the first one that you kind of want to solidify, so that then as you move more, you can keep that pressurization of your core and have some of that underlying stability, instead of when you can't pressurize, other muscles from a link tension relationship have to pick up the slack. So that's how I tie those together: breathing, movement, stress.
Movements are always interesting. I think that people get caught between too little and too much. So what's too little? Too little is sitting on the couch and doing nothing. Like, that is, people always ask, like, how much can I do? My explanation is always along the lines of this: sitting on the couch, you will get worse. If you want to go run a marathon, you're going to get worse. Okay. So, and I know it's a big range, but if you start thinking about it along those lines, you start going, okay, yeah, a marathon is like way too much.
Right.
Where's my not too much? And that not too much might be, you do a couple of laps around the house.
Right.
And that's where you start. And that's okay. Or it might be you walk to the letterbox.
I was just going to say, letterbox program. Yep. Trademark.
Absolutely. But every time, that's the way I sort of think about it. Yeah. The couch is always too little. Marathons generally too much. So where are you situated in between it? Look, we all know it's closer to the couch, but you got to move towards the marathon. So.
Yeah. And what things can you pepper in when you're veering more couch versus what can you bias towards when you're feeling a little bit better, or you have a little bit more capacity? So I think that's the beautiful thing about movement too, is it allows you to pivot and work on different things depending on what's going on and hit different, buckets from a priority perspective.
So here's the thing with movement I find really difficult as well. And I'm going to give my own personal example here, is that, like, in the last 2 weeks, I had
Dad's been
this thing stuck in my hand, which I didn't know was there. Anyway.
I wish I could find this picture.
Oh my God, this thing I pulled it out. It was gigantic.
It was gnarly.
Anyway.
I couldn't believe it.
But here's the thing. All I do is I've got like my little,
If
yeah,
you're watching
there
on
it is.
YouTube, look
There
at
it
that.
is. She's holding it
Yeah.
up
I
like
feel
the
like that's worth,
gigantic thing that I
yeah,
pull out of my hand. So
it's
anyway,
worth showing.
so the interesting there is that the thing I was fascinated with is sure, I've got a sore, little finger and ring finger on my left hand, but it nearly stopped me doing everything. Like, I'm like, Dan, just go do legs. Okay. Like, go to the
Can't.
gym and do legs. I can't do legs.
If I can't do biceps, I don't want to do anything.
Well, I could do biceps, but nonetheless, I was interested in just reflecting on myself with like I have an isolated injury, and sure it hurt, but I was interested about how much it stopped everything else. And I have so many patients that come in and go,
Yeah.
my right shoulder is sore. Great. Okay. Have you been going to the gym? No, I can't do anything at the gym. I'm going, okay, dude, you've definitely got legs.
It's hard though. Yeah.
But I suffered exactly the same thing that all my patients
Yeah.
experience, that they have something that is off and hurts a lot, because like
Yeah.
the
People aren't
big
coming to you
piece
for
of wood stuck
baby
in my
pain.
hand. Yeah, people don't come to me for no pain, they come for me stuff that really hurts. But it's interesting. So I think that one of the other things that you've got to be able to do is go, okay, it is my knee, hip, shoulder, whatever that hurts. What else can I do?
What can I do?
What else can I do? And that is difficult to do in many cases.
Yeah.
But you've got to go, okay, everything hurts, but my left bicep still works. Okay, I'll work on my guns on my left side. Like that'll do. And interestingly, there's really good data that you get transference to the opposite side if you work the left.
Yeah.
So all the stroke data, when you're relearning how to work, when you're redoing your stroke rehab, you get contralateral transference of like nearly 80% of the effect. So if you can't work right, that's okay. Work your left.
Yeah.
And your right side will benefit. So some of the magic of crossover of the brain, very good. But it takes motivation, even for like me.
Yeah, motivation and the skill set to know what can you pivot to, and knowing yourself well enough to identify, I'm not feeling or able to do what I would normally do, but I can do something. And that's what actually keeps you consistent, right? I too actually can't maintain my workout routine always like it's written all the time. It's when I have to not do that, knowing that there's other things I can insert, and then that keeps you still, progressing over time. So that's a great point.
So move it or lose it. Motion is lotion. I like motion is lotion. That's not a bad one as well.
Use it or lose it. Creates a little bit of paranoia, but it's not wrong. No, definitely not wrong. I think what we could probably go into next is how to actually progress breathing a bit. And one other thing to just note quickly is if you have a lot of upper quadrant instability, that can also affect diaphragm function and how you're able to stack and pressurize.
What's upper quadrant instability?
It's like a shoulder instability.
Okay.
Scapular instability, T-spine issues.
Yep.
Neck,
bunch of my patients.
All that. Right.
Yep.
So, and that kind of goes both ways, where upper extremity issues can affect breathing. Weird breathing patterns can further instability in those upper quadrants. So I look at those as upper quadrants, lower quadrants, or like hips down. All right. So a good way to think about how can you start to shift your breathing, don't worry about movement yet, just pay attention to what you're doing at rest. So like I talked about earlier, notice if you are a mouth breather, no insult intended. And just step one is paying attention to closing your mouth and trying to breathe more in and out of your nose during the day. That's it. Over time, ideally, that will then translate to what you're doing at night when you're unconscious, because when you're unconscious at night, you're not going to do something that you're not used to doing consciously yet during the day. And not having your mouth open all night when you're breathing is also a really big shift that can help sleep quality and different things. And if you have apnea, some of these things can be a struggle for other reasons, but I always talk about getting something to shift from conscious to when you're unconscious. And that in and of itself will create a lot of hours where you're breathing in a more ideal way that's pushing you towards parasympathetic instead of things that are reinforcing sort of the sympathetic fight or flight. Mouth tape is also something you can use. Have you ever used that, Dan? Post-nose surgery?
No.
Okay.
Post-nose surgery?
Well, yeah, you couldn't breathe for quite a while. Remember that?
Oh, yeah, I know, but I was...
Once you could breathe out your nose. Did you ever
Once
play
I
with
could
that?
like, yeah, lost once the blood and the snot all stopped. Yeah,
It
it
was a
was all
look.
good.
Yeah,
Yeah,
so
it
that's
was good.
something you can try too if it doesn't freak you out or feel uncomfortable. Ideally, practice during the day first. Don't just go from nothing to putting mouth tape over your mouth at night. But that is also something that can help encourage more nasal breathing. And then you can start to practice some of the stuff in the more developmental positions. So whether you're, on your back using a band, kind of pulling a bit, that can create a little bit of then tension in your stomach that you can kind of breathe and brace simultaneously. A lot of the more classic positions like 90-90, where you're on your back and it's called 90-90 because you're bent at the knees and your feet are on a sofa. That can be a nice sort of decompressed spinal position to practice it. And you can have your hands, if you're watching on YouTube, just kind of on the outside of your rib cage and either focus on that part expanding more laterally rather than coming up here, or have a hand, chest and tummy, and focus on this hand moving more than this hand. The reason I
Yeah,
don't
so this hand was like abdominal hand or
yeah,
chest hand?
chest hand. Yeah. Thank you. Yeah. The reason I don't super love this position is because I don't just want you to breathe forward when you're breathing diaphragmatically. We want you to breathe sort of 360 degrees around and be able to expand, from your back as well. So I kind of prefer this position for that, but this can be helpful just to sense the difference between, oh yeah, I'm moving a ton from here, less here, more elsewhere. Then you can also do things like crocodile breathing, especially if it's hard for you to push into your back, where laying on your
Crocodile
yeah,
breathing?
it's a stupid name, but laying on your stomach, you'd have a pillow under your abdominal section, and that then doesn't allow you to push forward as much when you breathe. And it's going to naturally encourage you to expand more where you're less comfortable or used to. It's just motor control, just like anything else. And for me, with the battery, it was really hard to expand kind of that back quadrant of my back. So I had to work pretty hard to improve some of the control around there to do so. And then same idea, you can block different kind of spots on your body. You can do it inside lying, put a pillow there, practice more expansion elsewhere, and hook lying as well on your back with your knees bent like that on the ground, if you prefer that to the couch option. So that too is kind of the at
I
rest
would
bucket.
never have thought about all that stuff around breathing.
Just the whole world. I know. I'm like, I can't really demonstrate this very effectively on a podcast, even on a video podcast, but this is
Oh
why
my
Basecamp
God.
is fun, because I can demonstrate all this, teach you, help you integrate it, and then you progress basically from at rest to these different positions. And then you can start to practice in like half kneeling, tall kneeling, and start to see how this translates to movement. But none of
Okay,
that
I,
sticks.
I I'm gonna put my hand up. I'm a mouth breather, like because
Yeah, I knew it,
this is
Dan.
this is like I'm like
I knew it.
I go okay, all
Okay,
right.
we'll do some
I'm just
breathing.
like just get on with it breathing. So
That's all with the breathing. I know. The other trick you can do is even I kind of prefer, because it's helpful to have feedback. So from a tactile perspective, either your hands again on the outsides of your ribs in standing, or you can tie a little band like right above the top of your tummy, kind of suck in a little, tie the band, and not so tight that you're uncomfortable. But then when you are at a normal resting position, the band will be it will be tight enough that you can feel the way you're expanding or not all the way around. And it's easier to expand into sections that you can feel. When you don't feel anything there, especially if you have sensory stuff or a lot of pain that's distracting, it's just hard to. So those are ways to teach your brain how to use all 360 degrees of you, and then you can start to see it translate into movement, which
this
should
is why
be
we're such a good
automatic.
team because I'm rubbish at this stuff. So you're like,
I'm rubbish at stabbing and jabbing people, Dan. That's I
there
know.
you go.
That's it. That's it. that's I'm like, I don't want anyone to freak out like, oh my God, I've been breathing wrong all this time. But I'm like, it's okay. Everybody's breathing. It's fine. But it's just like other things. If you can optimize it and help move the needle in the right direction, it's worth it.
All right. How do you
All
tie
right.
that in with some mindfulness? This is the other thing I'm like,
Yeah.
not exactly the
This is
greatest at.
Dan's other favorite. So I like, this is a good discussion because I like having breath be the foundation to mindfulness. And I actually came up with this incredible acronym called the BAD Mindfulness Framework, BAD. It stands for breathing first, awareness, that's kind of the different mindfulness components, and then distancing, if we're talking about distancing yourself from stressful thoughts or things that are going on in your subconscious that you hadn't really been paying attention to. So I use breathing to kind of bridge the gap into mindfulness, where that breathing in and of itself, if you put 5 on the clock and you're just kind of paying attention to that, and once you're comfortable with that, then you can layer in some mindfulness practice, like kill two birds with one stone, in that same 5-minute window or whatever makes sense for you. And if 5 minutes is a lot, do 2 minutes. Like do 2 minutes, 1 minute, 2 minute. You could do 2 minutes, 1 minute, 1 minute, 1 minute, whatever. It's however you need to kind of break it down to not make you feel uncomfortable is totally fine. And then just like anything else, you just progress it more over time. So a couple exercises that I would say very first to combine breathing and mindfulness are one called the Stop meditation log. And these two are resources that I use with clients and I give out in Basecamp. So I can't go into as much detail as I would want to with them in this setting, but I'll give as good of an overview as I can. So with the Stop meditation log, for example, put 5 minutes on the clock, stop, like slow down. That's the S. Take note, notice what you're feeling, thinking, what are you doing? I know this stuff is annoying, especially if you haven't done it before, but just bear with me. Then open up, make space for your thoughts or your feelings and allow them to kind of flow right on by. A lot of people get tripped up thinking mindfulness or meditation is about not thinking of anything or clearing your brain. It's not. It's just letting whatever weird stuff comes up sort of float on by and not getting hooked into any one thing. So it's becoming an omnipresent observer of your own thoughts and not having any judgment or reaction to them. It's not literally having no thoughts. That's not how our brains work. And then the P, especially if we're talking about things in the context of values or what you're using this experiment for, pursue values. So it can be things like remember your values and finding a way to act on them. So seeing how you feel, kind of thinking about what you want, letting those thoughts float by and actually just jotting them down with regards to what you notice. And then another good one is called cubby holing. And same idea, put 5 on the clock. And this one just has different columns. And as you sort of just pay attention to what pops into your brain, you can jot down, was it an emotion? Was it a thought? Was it a bodily sensation, right? Was it pain? Is it, my back, my leg? That was my early days of mindfulness. Was it maybe an evaluation or a judgment? Was it a worry or like an urge of something you need to do or haven't done? Could it be memory related, like thinking about the past, different things like that? So having the space to basically pay attention to what you're thinking of sort of subconsciously and like under the surface is powerful because then you can identify those things and act on or change some of them. And a lot of people don't realize
you're identifying
how much
your stresses and
exactly
dealing with them.
Nice. Oh God, I know. It's the worst. So yeah, you can't change what you don't notice. This basically just helps you notice them. And it does take a bit of time to get more comfortable with that. And if you're uncomfortable at first, it's normal. Some other sort of areas of life that I like to use mindfulness outside of coupling it with breathing are chores in daily life. So the mundane things like doing the dishes while you're showering, when you're eating, like paying attention to what does the food taste like, chewing a little slower. How is the texture? Oh, does this taste good? Not just sort of scarfing it down and keeping it moving. In the shower, it's the type of thing where it's like, oh, what does the water feel like, when it's running down my arm? And what like experience am I having other than the painful part of my body? And really, these are an attempt to distract and filter a little bit with some of these more unfun things that you have to do throughout the day. And that pain can be kind of overwhelming throughout. The other bucket I like to use it in is managing higher stress, like we talked about. So more of an interventive to keep an 8 out of 10 from escalating pain-wise. The other reason I like to use it is from an emotional awareness perspective, kind of like these other two exercises we talked about, getting grounded, centered, checking in with yourself. And this a little bit relates to pacing too, where breathing in and of itself is kind of like a pressure release valve and a little adult timeout. So it's like stressed out, put yourself in timeout, downregulate a little bit, and then, get back to what you were doing. And then the last chunk of stuff that I use it for is, again, kind of shifting that baseline state of the nervous system, especially if you have sympathetic overdrive, like things with complex regional pain syndrome. So if you can get like 3x5, that's what I call it, like 3 5-minute sessions in a day, morning and night are easy. You're already in bed. And then one time during the day as sort of a check-in timeout, and you already got 3. And that adds up. And then the trick is getting that 15 minutes of practice to translate over to the other 23 hours and 45 minutes of the day. But it happens. It does.
Nice.
You just got to do it regularly. So those are kind of the daily life, your own personal awareness perspective when it comes to mindfulness. And then another thing Dan and I have talked a lot about is purpose. And we did an episode on goal setting too. And this is another area that I like to use it around accepting uncertainty, right? And uncertainty is an inherent part of life, just like stress. And if you're very uncomfortable with it, it's more difficult to deal with. So pain is uncertain, right? Our health is uncertain, and being able to cope with that is important. And choosing your responses to those stressful or scary things is also important, because it allows you to have less of that future tripping, catastrophization piece of things, and less of that automatic, unchecked, just stress response that just can run wild then.
Yeah, I think that the combination between accepting where you are now and combining with some goal setting
Yeah,
is very, very powerful. I think that
that's it.
where
So well
we
said.
where we start off a lot of the time is not from a point of acceptance, but from a point of sadness of
Right.
loss, sadness
Right.
about our loss. And so it's hard to set goals when you're completely focused on everything that is gone, and
Right.
which is so hard. So being able to go, okay, that's crap, but this is where I am now, and this is where I'm going to go with your goal setting is very powerful. And so I think that within that, you then come on to own it. Your self-efficacy goes up
Yes.
immediately, and they are and that is super powerful. Like, unfortunately, with chronic pain and particularly complex disease, if you don't own it, if you don't drive yourself, if you don't,
Yeah.
build your self efficacy, and you do that with simple techniques like this, breathing techniques, mindfulness, you don't get out. You
Yeah.
just don't get out. You want to guarantee you want to have chronic pain forever, blame everybody else, don't take responsibility. I'm
Right.
going to tell you
That's
that
rough.
is a sure recipe
I tried.
for
I tried that in the past.
long-term.
Did not work out well.
Just tried that.
I've tried. Just do not
Yeah, it
recommend.
doesn't work.
I've
No,
tried
it
both
doesn't work.
ways. I would highly
It doesn't
recommend the
work.
latter. Yeah.
Yeah, yeah. The second one's
Yeah.
like, own it.
Still hard,
Unfortunately,
but agency.
and when we say acceptance, that's not acceptance of the disease process, stuff that.
Yeah.
It's acceptance of where you are now. Like, it's the position you're in. That's where I think about acceptance commitment therapy, which is
Yeah.
kind of a version of what we're talking about.
Mm-hmm. Yeah. No, there's a lot of
Um,
ACT concepts wrapped in
yeah,
this, and
and I
I
think that's super important. I think we should, like, we'll get Dave Young at some point in time. He's a psychologist. So
yeah,
he's a big acceptance and commitment guy. I love his stuff. So I
yeah,
think that's really important. And having these simple techniques that allows you to go, okay, this is where I'm at. Let's do some breathing. I'm going to start with 3x5. I'm going to then integrate my mindfulness, and I'm going to set into there then some goal setting that will allow me to start moving forward. Bring it on.
exactly. Yeah, one of my favorite quotes around acceptance is that acceptance is not resignation. So, like,
Nah.
acceptance has this very negative connotation, like you're giving up and you don't think things can get better. It doesn't mean that. It's just like Dan says, it's accepting where you're at while also fighting to improve. And the acceptance part just allows you to not feel like you're like swimming upstream in that fight. And that's been a nuanced conversation I have with CRPS patients too, where when you always feel like you're fighting something, it's draining and it's exhausting and it's kind of demoralizing. Instead of, it's like you're still fighting it, but you're kind of going with the lazy river, and like you're going with the flow and changing the things you can, but not resenting to the point that it negatively affects you the things you can't yet. Not ever, just yet.
Yes. All right.
Yeah, so that's a big caveat.
So, in summary, you got to get after it. And, like, this is the basics of how you own it, how you build your self-efficacy, how you get after it, and how you manage that stress that is 100% normal.
Right.
Like 100% normal. If you're not sad, if you're not anxious, if you're not stressed, because of the effects of chronic pain in your life, you're not normal. And so it's okay. You still got to manage it though. And so
Yeah, because
if
it
you're
is
looking
normal.
for,
So you have to
it
manage it
is.
because it's a normal piece of it. Yeah, it's not the
Yeah.
outlier. Right.
All right. Once again, if you're looking for additional help with this sort of stuff, look at Jaz's website, resilientwarriorcoachingllc.com. She does her base camp, which she's mentioned a couple of times. So good plugging on the way through,
Yeah.
Jaz.
Thank you,
And
Jazz.
yeah, go have a look at her resources. Look her up
Yeah.
on Insta. She's got tons of stuff there that is useful. Get a bit of a sense of how she approaches things outside of what you hear on the podcast.
Yeah.
And reach out.
Exactly.
She is very worthwhile.
Appreciate it, Dan. Thank you. Yeah, and there's a lot more to talk about with these types of things from a breathing and from a mindfulness perspective. And there's so many more specifics and details and actual exercises that one can get into when you're in that context. So for this discussion, that was a really good overview. And the last little thing that came to mind that I would also suggest is if you're working on your breathing outside of the positions, then start to play with the tempo that you're breathing at. So you can start to go like triangle breathing, square breathing, right? These different shape breathing exercises where you first, when you're newer, slower, less tempo, like 2 seconds in, 2-second pause, 2-second out. And as you get more advanced, you can elongate the exhale. You can add more time before you inhale again. You can make both the exhale and the inhale longer. And that's another way that you can sort of decrease that need to like gasp for air and train really that CO2 response piece of breathing. So there's lots of fun rabbit holes that you can go into under both of these buckets. And this will give you a really good starting point to start to integrate the things that matter.
Nice. All right.
Perfect. All right.
Thanks, Charles.
Thanks, guys. Thanks a lot, Dan. We'll see you next time on It's Not in Your Head.
Cheers. Bye. Thanks for listening. Clearly, this is a podcast. It's for informational purposes. It's not a consult, medical advice, or the practice of medicine, and it doesn't form a therapeutic relationship. If you feel the information might be useful for your situation, before applying it to yourself or others, you should speak with your doctor or your treating clinician. Do not delay in seeking a diagnosis or treatment, and applying the information is at the listener's own risk.